this panel discussion, we will hear from our panelists the barriers that stand in the way of cancer care in India, and according to them, what solutions can be suggested to break down these barriers. The first barrier which we will be discussing is about screening. So what do you mean by screening? In screening, certain tests are done to identify cancer even before signs and symptoms appear. So let us hear from Dr. Shikhar more about screening as a barrier.
It is well known that early detection of cancers by screening saves lives. Now, the three most common cancers in our country, that is cancers of the breast, cancer of the cervix, and cancers of the lip and the oral cavity. All these three types of cancers, if they are detected at an early stage, they are curable. Now, for cancers of the cervix and the breast, there are screening tests available. What does a screening test mean? That even long before a patient gets the symptoms of that cancer, this test can detect the earliest stage of the cancer in that person. Now, for cancers of the cervix, there is a simple test called a Pap Smear, which is an outpatient procedure. It is very cheap. The only thing required for that is good quality control and a pathologist to report the Pap Smear findings. And for a cancer of the breast, there is a simple test called the Mammogram, which is nothing but an X-ray of the breast, which also can be done at a very cheap cost, and it can be easily be made available in the districts and in the rural communities as well. Let me give you a small example of the impact of screening on cancer detection. For example, if a breast cancer is detected by screening in the first stage or even before the first stage, the cure rate is more than 95%. The same cancer, if it is not screened, if it is allowed to grow, and when the woman actually feels it in her breast, when it has grown to the size of a lemon or bigger, the cure rate drops down to 70 to 80%. This is the impact of screening, and this is why in the West, where screening is so prevalent, the cancer cure rates of breast cancer are much higher than in India, where majority of women, unfortunately, they are ignorant about this screening test, and they present when the cancer is already advanced to the second, third and the fourth stages.